How are you doing? I just thought of something this morning around harm reduction and the journey that our clients take when they move from a culture of addiction to a culture of recovery. And what we're doing at the foundation is we have a CBT program, cognitive behavioral therapy program, which is made up of the 12 steps and 5 pillars, which I'm sure you're aware of. And when our clients come in, they're made aware of how they used to use, misuse, abuse, and became dependent on the substance, and how they then need to kind of break out of denial and move into a culture of recovery. And that's what the process is. So when our clients first start moving from a harm reduction program where they've gone from opiate-based addiction like heroin to methadone, and they want to reduce that, the harm reduction program is reducing the harm and moving them towards confronting their denial and then entering a culture of recovery, which we hope is complete abstinence. And the 12 steps are very beneficial for that. The role of the recovery coach, however, what our training does is it trains people up to in the profession of a professional recovery coach, and they have conversations with their clients based around this model to assist the client in creating recovery capital by enhancing the biopsychosocial model, the medical model, and the self-help model to get the client to take accountability for creating recovery based around all those 4 components. And this we cover all in Module 1 of our recovery coaching training. In Module 2, we confront wellness, so how our clients, when they understand their illness, their substance abuse disorder, to substance misuse disorder, to moving to a culture of recovery, that moves along a continuum. Just like now they understand what their diagnosis is, they've got the disease of addiction or whatever that might be, they are then moving towards premature death or hopefully to high well-being, and getting them to understand the diagnosis, their illness, to take responsibility for their lives, and how they are going to move to what recovery looks like for them. This is all based in an adult learning environment, and we bring in emotional intelligence. Addiction is born in shame, and so we bring in emotional intelligence around the 4 core feelings: anger, sadness, fear, and joy, and how our clients have been unconsciously incompetent, become consciously incompetent, become consciously competent, and then hopefully they become unconsciously competent in living in a culture of recovery, because recovery is a very traumatic time. They've lost their drug of choice, they've lost their best friend, they're in a state of grief, and it can be very traumatic. So we teach our clients how to respond to the traumatized brain by using this coaching model, and then hopefully our clients move on to Module 3 of our training, or in the clinic they move on to the recovery wellness program, where they realize they are part of a system and they need to rebuild relationships with family and community and go out and become self-supporting. So Module 3 educates the coach on how to assist in a systemic environment, and how, as we move the client from a culture of addiction to a culture of recovery, we are moving society from a culture of addiction to a culture of recovery. So when the client changes their behavior, it impacts the family, and then it impacts communities. And our hope is that by uplifting everyone within the system, the whole system raises up. Costs of treatment come down, family lives are restored, there's more of support generated for the client or the addict to assist them in going back into the world and becoming productive, responsible members of society, and essentially taking responsibility for their own lives. And then to finish off, our training creates the role of the professional recovery coach, and the whole lot of ethics and business considerations to make up what is the role of a professional recovery coach, how does it work, how does that role work within a treatment environment, how does that role assist our clients in moving from a culture of addiction to a culture of recovery. And what I'm hoping to do is, when I come over to you guys, is to put this out, and then in the week that I'm with you guys is to start to look how we can integrate your existing 12-step program into the paradigm of recovery wellness, and how the role of the recovery coach can assist the clients in empowering themselves to move forward, which is essentially going to lift up everyone, I hope, and make the world a better place. I feel like I've been doing the weather. We've got recovery storm clouds brewing over there, and we have bright sunny days over here. Nice to send you a video, love. Bye.